Assalamu alaikum. Read in the name of Allah, who is most merciful and beneficent. Today, my topic is photodynamic therapy. My name is Aisha Zal and I am from PSPT department. Introduction to photodynamic therapy. Photodynamic therapy is a medical treatment that uses light-sensitive drugs called photosensitizers, along with the specific wavelengths of light to destroy or treat abnormal cells. The process involves three main components: a photosynthesizer, light of an appropriate wavelength, and oxygen. History. The history of photodynamic therapy is earlier 20th century when researchers began exploring the effects of light and certain chemicals on living organisms. In 19th, Oscar Raab, a medical student, discovered that certain dyes could cause skin sensitivity to light. In 1960s, Thomas Doherty and his colleagues at Russell Park Cancer Institute in the United States conducted pioneering research on PDT. In 1970s and 1980s, clinical trials involved PDT were conducted for the treatment of various types of cancer, including skin, bladder, and lung cancer. And in 19, the USA Food and Drug Administration approved the use of new photosynthesizers called photoprin for the treatment of early-stage lung cancer and esophageal cancers. In recent years, PDT has been used for the treatment of non-cancerous conditions, including age-related macular degeneration, acne, skin lesions. It continues to be subject of ongoing researches and clinical trials to explore its potential in various areas of medicine. Basic principles. The basic principle of photodynamic therapy involves the use of light-sensitive compounds called photosynthesizers to selectively destroy targeted cells or tissues. The process involves three key components: a photosynthesizer, a specific light wavelength, and molecular oxygen. When a photosynthesizer is administered to the body, it localizes within the targeted cells or tissues. Subsequently, light of a specific wavelength is applied to the area which activates the photosynthesizer. Upon activation, the photosynthesizer transfers energy to the molecular oxygen and surrounding environment, generating higher active oxygen species such as syngnate oxygen. The reactive oxygen species that induce a series of destruction events, including the oxidation of cellular components, damage to cellular membranes, and the initiation of apoptotic and neurotic cells death pathway. The photodynamic processes selectively as the photosynthesizer accumulates preferentiality in the targeted cells or tissues, leading to the localized damage while sparing healthy surrounding cells. Photodynamic has been utilized in various medical applications such as treatment of certain types of cancer, skin conditions, and microbial infections. Light photosynthesizer and oxygen interact to create a therapeutic effect of photodynamic theory. Photosynthesizer, which is a light-sensitive compound, is administered or applied to the targeted area. The photosynthesizer selectively accumulates in the targeted cells or tissues either through passive diffusion or active targeting mechanisms. After an appropriate time for the photosynthesizer to distribute and localize, the targeted area is exposed to light of a specific wavelength. This light can be delivered extremely used laser, light emitting diodes, LEDs, or other light sources. The absorbed light excites the photosynthesizers, causing it to transition from ground state to excited state. In the excited state, the photosynthesizers transfer the energy molecular oxygen present in the environmental surrounding. The generated reactive oxygen species, particularly stimulated oxygen, and are highly accurate and the induced cellular damage. They can oxidize cellular components, distribute molecular membranes, the induce cellular damage, whether through oxidate stress, direct injury, or activate or cell death pathway, ultimately leads to the desired into therapeutic effect. Types of cancer and other disease that can be treated with PDT. Cancer. Skin cancer. PDT is commonly used to treat basal cells carcinomania and squamous cell carcinomania. The most common types of skin cancer, lung cancer, PDT can be utilized as a local treatment of earlier lung cancer, particularly for tumor located near the surface of the airways. Esophageal cancer, PDT is used to treat earlier stages of esophageal cancer, particularly for tumors that have not been deeply invaded the esophageal wall. Head and neck cancer, this cancer treated the oral cavity, throat, and other head and neck regions. Gastric cancer, this type could be treated including the bile conduct cancer and early stages parental cancer. Bladder cancer, this type treatment option are superficial bladder cancer. Non-cancerous conditions, age-related macular degeneration. It is used to treat certain forms of AMD, a leading cause of vision loss in older adults. Acne, PDT can be employed to target and reduce acne-causing bacteria and sebaceous gland in the skin. Psoriasis, PDT can be explored as a treatment of psoriasis, a chronic inflammatory skin condition characterized by red scaly patches. It's important to note that the validity and the specific applications of PDT may vary depending on factors such as medical guidelines, ongoing researches, and individual patient characteristics. The suitability of PDT of particular condition should be determined through consultation with a healthcare professional. Advantages of photodynamic therapy compared to other cancer treatments. PDT is selectively targeted cancer cells with superior surrounding health tissues to some extent. The targeted approach helps minimize damage to normal cells and reduce side effects. PDT is generally a non-surgical or minimal invasive treatment. It involves the administration of photosensitizer and the application of light, eliminating the need of extensive surgery. PDT localized activity of the photosensitizer reduce symmetry toxicity compared to the symmetric treatments like chemotherapy, which can affect the entire body. This can lead to fewer side effects. Number 4, PDT can be repeated multiple times in the same area without communicate toxicity, making it suitable for current tumors. It can also be adjustment therapy along other treatments to enhance overall efficiency. PDT can advantages for tumor located in cosmetically and functionally sensitive areas such as the face. It can help preserve appearance and organ function. Limitations of photodynamic therapy compared to other cancer treatments. The effectiveness of PDT is primarily limited to superficial and shallow seated tumors. Light penetration into deeper tissues is restricted, making it less suitable for large and deeply located tumors. Delivery light to the tumor site can be challenging, particularly for deep-seated tumors. For those located in challenging anatomical locations, adequate light delivery may require surgical procedure or specialized equipment. Number 3, after PDT, patients may experience sensitivity to light for a period. They need to avoid direct sunlight or bright indoors light sources for this to skin reactions and minimize discomfort. While PDT has shown efficacy in various cancer types, the clinical evidence may be comparatively limited compared to established treatment, modified such as surgery, radiation therapy, and chemotherapy. Not all patients or tumor types are suitable for PDT. Factors such as tumor characteristics, life, location, and individual patients factor need to consider to determine its suitability and optimal outcomes. It is crucial or consult with healthcare professionals and consider all specific characteristics of cancer and the individual patients while when evaluating treatment options. A multiplicity of approach can help determine the most suitable treatment strategy. Recent advances in photodynamic therapy. Second generation photosynthesizers, researchers have been exploring and developing new photosynthesizers with enhanced properties such as improved absorption, emission wavelength, high signal oxygen quantum yields, and better human selectively. Non-structured photosynthesis, non-technology-based approaches have been used to create photosynthesizer with unique properties, including enhanced tumor for targeting, improved stability, and control release of photosynthesizer in the tumor microenvironment. Light sources. LED have been gained popularity as a light source for PDT due to flexibility, cost, effectiveness, and ability to deliver light at specific wavelengths. Fiber optic based light delivery system offer improved perception in light placement, enabling better targeting for deep-seated tumor or anatomically challenging areas. Delivery system. Topical formulation. Advances have been made development for topical formulation of photosensitizers, allowing for non-invasive treatment of superficial skin lesion and condition. Multiple functional carriers. Research have been explored use of carrier systems such as non-penetrating liposomes and photosensitizers delivery. These carriers can be enhanced tumor accumulation, improve stability, and enable targeting for trigger release of photosynthesis. Combination therapies, PDT, have been combined with other therapies such as immunotherapy, chemotherapy to enhance treatment outcomes. These approaches can be enhance the therapy effect and potential overcome resistance mechanism. These recent advances aim to overcome limitations associated with PDT, such as limited tissue penetration, hence selectively improve treatment outcomes, and expand the range of applications. Ongoing research and development in these areas hold promise for further advance in the field of photodynamic therapy. Preclinical and clinical studies on efficiency and safety photodynamic therapy. Clinical studies. Preclinical studies have been demonstrated the efficacy of the PDT in inhibiting tumor growth and including tumor cell death and variety of cancer cells, including skin, lungs, breast, and prostate cancers. PDT has shown a degree of tumor selectively with preferential accumulation of photosynthesizer in tumor minimal disease surrounding to health tissues. Preclinical research has explored the combination of PDT and other treatment modifiers such as chemotherapy, radiation therapy, immunotherapy, showing potential synergistic effects and improved outcomes. Clinical studies. PDT has been extremely studied and proven effectively in the treatment of non-melanal melanoma skin cancer cells such as basal cell carcinoma and squamous cells carcinoma. With higher clinical trials have invested the use of PDT as a local treatment for early stages lung cancer, particularly for tumor near the surface of airways, with promising results. PDT has been shown essentially in treating certain gastrointestinal cancers, including esophageal, bile duct cancers, while as a stand-alone therapy or in combination with other treatments. PDT has been established as a treatment optional specific forms of PMT effectively targeting abnormal blood vessels in the eye, slowing disease progression. PDT is also has promises in the treatment conditions such as head and neck cancer, bladder, acne. Although further research is needed to establish extensively in these areas. Safety. Common side effects of PDT includes temporary skin sensitivity of light, swelling, redness, mild pain of the treatment side. These effective are typically well tolerated and resolve over time. Patients are advised to avoid exposure of bright sunlight, including sunlight, indoor light, or specified period after PDT to minimize skin reactions. PDT has generally been considered safe with the low intense incidence of severe adverse event. However, patients electively and careful monitoring are essential to minimize risk and ensure optimal safety. It's important to note that the efficiency and safety of PDT can vary depending on the specific diseases, treatment protocols, and individual patients' factors. Consulting with healthcare professionals with participating in clinical trials can provide more details and tolerate information regarding the efficiency and safety of PDT of specific conditions. How PDT affect cancer cells and immune system. Photodynamic is a treatment modality that involves the use of photosensitizing agent and light selectively select and destroy cancer cells. A photosensitizing agent is administration to the patient either symmetrically or topical, depending on the type of location of cancer. The photosensitizer is preferentially taken by a cancer cells that accumulate in high concentration compared to normal cells. After a sufficient time of photosensitizer to accumulate in cancer cells, light of a specific wavelength is applied to treatment area. The light activates the photosensitizer, leading to the production of a reaction oxygen specific, primarily singlet oxygen. The generated ROS are highly reactive and cause addictive stress and cancer cells. The ROS damage circular components such as protein, lipids, and DNA, leading to the cell death. This direct cytotoxic effects in one in, of the primary mechanisms of cancer cell destruction in PDT. PDT also affects the tumor circulated. The ROS produced during PDT can cause damage the tumor blood vessels, leading the vascular distribution, blood clotting, and reduced blood flow. The vascular effects contribute to tumor ischemia and further tumor cell death. Improving specific and selectively photodynamic therapy, researchers are developing various approaches to deliver photosynthesizers specifically to cancer cells or tumor associated structures, minimizing their uptake by normal tissues. They can involve conjugating and photosynthesizer by targeting molecules such as antibiotics, peptides, non-particles, which selectively bind to cancer as well, specific market for tumor vascular. Advantages in light delivery techniques allow to more precise targeting of treatment area, minimize exposure to surrounding health tissues. Methods such as fiber optic based devices in terrestrial PDT or intraappropriate PDT involve localized light delivery to tumor sites, enhancing specific optimizing treatment parameters photodynamic. The dose and administration route of the photosensitizer play a crucial role in PDT. It's important to determine the optimal photosynthesizer dose that achieves sufficient accumulation in the tumor while minimizing systematic toxicity. The administration route should be chosen based on the tumor type and location to ensure adequate photosynthesis take up by cancer cells. The light dose, which refers to total amount of light energy delivered to the influence rate, which is rate at the light energy delivered are critical parameters in PDT. Finding the right balance between light dose and influence rate is important to achieve effective tumor destruction while minimize damage to surrounding health tissues. Optimizing can involve addition to light sources, intensity, treatment, duration, or infection schemes. Optimizing treatment parameters in PDT requires a personalized and multi-phased approach. Consider the specific tumor characterized photosensitizers, appropriate a real monitor through careful adjustment of these parameters. PDT can tailored to maximize treatment enhance while minimizing side effects. Expanding applications to other photodynamic. Photodynamic has shown promise in treating various types of cancer, but its applications are not limited to oncology. PDT has been explored and expand to other fields as well. As researchers continues, PDT can maybe find further application in different fields, driven by its ability to selectively target cells and potential and for non-invasive and localized treatment. Photodynamic therapy. Chemistry plays a crucial role in PDT, particularly in the design and synthesis of photosynthesizing agents. Chemists develop new photosynthesizers with improved properties such as enhanced selectively, increased absorption in specific wavelength ranges, and optimize the photophysical and photochemical characteristics. Biology is integral to understanding the biological mechanism of PDT. Biologists study photosynthesizer interact with cells and tissues, the cellular uptake and localization of photosynthesizer and the mechanisms of cell death induced by PDT. They are also investigate the immune response triggered by PDT and the impact of tumor microenvironments. Physics is essential in understanding the behavior of light and interaction with tissues during PDT. Physicists study light absorption, scattering, and penetration in different tissues, as well as the develop models computations tools to predict light distribute and dosimetry during treatment. They also contribute the development and innovative light sources and delivery light systems. In engineering, disciplines contribute to the development of PDT technology and devices. Engineering designs and optimized light and delivery system, including fiber optic devices, light sources, and dimensional tools. They also work on developing imaging techniques for real monitoring during PDT procedures. Clinical researchers and medical professionals play also a crucial role in PDT by conducting clinical trials, evaluating treatment outcomes, and translating PDT from the laboratory to the clinic. They contribute to refining treatment protocols, assessing safety and efficiency, and identify patient selectively area or criteria for different applications of PDT. Nanotechnology has emerged as an important area with PDT. Nanoscale systems such as nanoparticles, liposomes, and nanostructured carriers are usually to enhance the delivery and targeting of photosynthesizer, improve their stability, and enhance their therapeutic efficiency. Non Nanotechnology also offers opportunities for combination therapies and imaging guided PDT. Thank you. I hope you all understand my topic, photodynamic, well.